afternoon. Today, I'm going to discuss some ergonomic tips for teleworking and home learning using your digital devices. My name is Dr. Joy Ramirez, and I'm a practicing internist and an occupational medicine diplomate. Due to the current COVID-19 pandemic, several employees have been compelled to work from home, and students have no options but to engage in virtual learning sessions. What many people fail to realize is that frequent overuse of these technologies in conjunction with poor ergonomics can be responsible to some health issues in the eyes and our musculoskeletal systems. Thus, appropriate factors and ergonomics should be followed when teleworking or attending online meetings using your smartphones, tablets, and laptops to attain a conducive indoor working and learning environment. Here are some practical tips that can be put into practice by employees and students working and learning at home using their digital devices. First, we have to know what is ergonomics. This is an applied science concerned with designing and arranging things people use so that those working or learning at home maintain their optimum productivity and, more importantly, reduce injury risk. Meaning, fitting a workplace to the person's needs with the goal to increase efficiency, at the same time reduce his discomfort. So how do we go about this? First tip is to prevent the digital eye strain. So we practice the 20-20-20 rule. Here, you set an alarm for every 20 minutes while using your digital devices as a reminder to take a break. Okay. Then, look at something 20 feet away for 20 seconds. This is because you have to change your focus after constantly working on a certain distance, that is your computer. And looking at far distance, the pupillary muscles constrict and relax, and during the relaxing phase, there is an increased blood supply in the eye. Other option is you can always close your eyes for 20 seconds every 20 minutes. Okay. So your eyes can rest. Okay. The next tip is blink regularly. Don't forget to blink. Blinking 10 times every 20 minutes replenishes your tears and prevents dryness and irritation. This is a common findings in our opta cases where people always have these dry eyes and they have to buy expensive lubricants for their eyes, for their dry eyes. So you just blink, blink, and blink. Okay. Smartphones and tablets are usually equipped with a number of setups, ideal for ergonomics. Using these settings, you can adjust your device based on your needs. Example, you adjust the brightness on the device to a comfortable level. Having your screen too bright or too dark stresses your eyes out and can cause problems maintaining focus. If you are in a dimly lit environment, you should decrease the brightness to prevent headaches. Kasi lalakas yung glare. Okay. Adjust the font of displayed text to a comfortable size. Okay. Or you can use bold text and zoom if there's difficulty in reading small letters. Adjusting your smartphone text contrast and size makes it easier to read web content, email messages, and everything else in your phone. This is an advantage to senior citizens Who wouldn't want to use their glasses when using their cell phones? They usually set their phones to the largest size, which could be also a disadvantage since people around him can also read his messages. Not too close. Many people tend to hold their cell phones only about 8 inches from their faces, which is not good. Viewing distances that are too short may cause your eyes to work harder to focus, and may require you to sit in awkward posture. So make sure there's a distance of 18 to 24 inches between your eyes and your phones or computers. Following these tips, you can prevent having digital eye strain or what we know as computer vision syndrome. Many of our patients are complaining of headaches, blurred vision, dry eyes, and even neck and shoulder strain. When we ask them the nature of their jobs, usually it's computer related, like call center agents or in the IT. Our next health issue, which we try to avoid, is the musculoskeletal disorders when we use our digital devices and laptops. First, know the proper sitting and standing posture. Yeah. When you look at the picture, this is the proper way to sit in front of the computer. First, you sit up straight, pushing your hips as far back they can go in the chair. This will assure us that you are sitting with your back straight. Okay. Adjust the seat height so your feet are flat on the floor, 90-degree angle to your lower leg. Your knees should form a 90-degree angle on your lower leg and thighs. Adjust the armrest so your shoulders are relaxed. Your elbows should be bent about 90 degrees, close to your side, and your wrist should be kept at 180 degrees or almost straight position. Again, distance of the screen from your eye should be at least arm's length or 18 to 24 inches, and top of the screen should be at eye level. Your keyboards and mouse should be placed in your forearm reach limit. Okay. So what if the chair is not adjustable and is a fixed chair in the dining room or in the kitchen? What if the table is too high? What you can do is get stacks of magazine, mga libro, and then place it under your where you can sit and elevate your chair, your sitting position, or you can put footrest on your feet, or even stacks of books or magazines also. So you don't have to buy new chairs or computer chairs. Just make use of your magazines and books to elevate your body so that your elbow will remain at 90 degrees and your wrist at 180 degrees. For someone standing, position of the standing desk should be at the height of the elbow, or it could be slightly lower. Keep your neck tall and shoulders relaxed. The wrist should be 180 degrees to the forearm. Monitor is again at eye level, and distance of the eyes from the screen is 18 to 24 inches, but should be tilted backwards 20 degrees for better viewing. Place a footrest to shift weight between feet, elevating one foot at a time as comfortable. Kasi by shifting weight between legs, you engage the muscles and you improve the blood flow. So, knowing the proper sitting and standing positions when working on computer is very important. Kasi it's healthier if we work in multiple positions than working in one position, especially if you have to work for long periods of time. Continuous standing or sitting while working is a common source of discomfort and fatigue. Frequent changes of body positions include alternating between sitting and standing will help to avoid and prevent body pains. So how do you do this? Use of height adjustable sit-stand workstation this is one way to ensure flexible postures. Adjust the height of the table at your elbow level or slightly below it when both sitting or standing. Use a timer if it's hard to remember when to sit. Ideal ratio is 1:1 up to 1:3 hours, meaning if you are sitting for 1 hour, then you will stand for 1 hour or hanggang 1 hour sitting or 3 hours standing. Depende kung saan ka comfortable. If you don't have adjustable sit-stand workstation, you don't have a standing desk, you can also set your timer every 45 minutes wherein you will stand and walk around your workstation. Go to the restroom, have a restroom break, go to the kitchen for 5 minutes. The key here is to reduce the total amount of sitting time in a day. We are showing how to ergonomically hold a mobile phone. The first picture shows how most of us hold our cell phones, which is wrong, right? So to keep our neck straight, we should hold our phones at eye level, pwedeng both hands, or pwedeng we support, one arm supporting the arm holding the phone, so para maging eye level yung screen mo. And then reducing the mechanical stress on your shoulder and neck. Oh, ayan. So you can see the strain when you bend your neck and your head. Yes. If you plan to watch a series of Korean novella or a 3-hour webinar, you can make use of your tablet or cell phone holder or stand. This will keep your device at eye level without straining your arms. Here are samples available in the market: cell phone holders and tablet stands. However, if you don't have to buy one, or if you don't want to buy one, you can use stacks of books or magazine. Okay, you just place the device wherein the screen is at the height of your eye level. Since you can see that holding your device with one arm with your head tilt forward can really cause stress on your neck. Mabigat pa minsan ang tablet. How about laptops? Pareho rin, same. You use a laptop riser or a box file or some books to elevate your laptop. Okay. Then you position your laptop so that the top of the screen is placed at eye level or slightly below it. Here's an example. Okay. And here is the samples that are available in the market. Shopping online. Reminders. The screen should be at least an arm's length or 18 to 24 inches away from you. You should use external keyboards when typing. And again, observe proper sitting or standing position. So our next tip is with the use of external keyboards. We use external keyboards when we have to text on our tablet or smartphone for a long time. Here are samples of external keyboards on your cell phones and tablets available in the market. Typing for a long period of time on a tablet or smartphone keyboard in a portrait mode causes a constrained posture. Also, the narrow key pitch of most tablets and smartphones can cause many typographical errors and affect our typing speed. We should remember that the keyboard should be placed independently from the device. This will allow your elbows to be bent about 90 degrees and close to your sides and wrists straight or 180 degrees. The presented tips aim to reduce harmful effects of prolonged use of smartphones, tablets, and laptops to your overall health, musculoskeletal disorders being the most common health issues. Most of our patients complain of neck pain, stiffness, low back pains, which are usually temporarily relieved only by pain relievers and muscle relaxants. Yung pala, posture nila while working hindi ergonomically correct. Have you heard of text neck syndrome? This is caused by typing for long periods of time on a tablet or smartphone keyboard in portrait mode, or hunching down to look at your wireless devices, causing repeated stress injury to the neck and shoulders. Symptoms usually presented is neck stiffness, fatigue, and pain. Sometimes nga, manhid, numbness of the upper extremities. This is explained by the fact that our neck muscles and tendons are meant to support our head's weight, which is 10 to 12 pounds. In a neutral position, bending your head forward at 45 to 60 degrees angle places 50 to 60 pounds force on the neck. This only means that the neck cannot withstand the amount of pressure over a prolonged period of time. Before I conclude my lecture, I would like to remind everybody na ergonomics is only a part of lifestyle change na pwede natin gawin. We have to also to exercise, keep our weight ideal as much as possible. Kasi kung mabigat ka and you sit for long periods of time, masasakit ang likod mo. Stress is also a big factor. That's why live a stress-free life. Try to enjoy life to the fullest. Okay. So to start, I'm going to invite everybody to join me in these simple stretching exercises to help prevent muscle stiffness. You just have to do this twice a day, very short and very effective. Okay, this is for the neck, for the shoulders, for the elbows, and for the wrist. For the neck, you have to remember only 3 T's. That is tilt, twist, and tuck. Okay? For the tilt, you have to bend your neck like this and bend your head on one side as far as you can for 10 seconds. Join me, join me. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Then, other side. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. For the twist, twist your neck to one side. I-align nyo yung chin nyo sa shoulder. Okay, go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Other side. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Sa top, the third key, you put your hands at the back of your neck. Try to stretch backwards a little and then push your head downwards, tucking your chin to your chest for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Okay na? You feel good na? You do? Okay, very good. So next is the shoulders. You rotate your shoulders forward 10 times. 10 counts, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Then backwards. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay? For the elbows, you put your hands again at the back of your neck. Okay, like this. Stretch. And then stretch inwards. One. Let's count one. Outwards. Let's count one. Two. Okay. Three. Four. Five. Six. Seven. Eight. 9, 10. Okay, very good. So, feeling better? Okay. For the arms and wrists, you extend your arms forward. Pull down your hand, your fingers downward for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Next, upward. Okay? 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. The other arm, other wrist. Okay. Okay. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Upward. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. But don't forget to wiggle for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Other direction. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. So, wow, that's good. You feel good. Okay, do that before lunchtime and after lunchtime. And I assure you, you will feel better, less aches, less stiffness. Okay? So, my conclusion is that since remote working and remote learning are no longer merely a trendy choice, minimizing the negative effects of our digital devices through proper ergonomics can give us a safer, more efficient, and more balanced lifestyles.
Okay, Dr. Joy.
Yes.
There are several questions here. One of the questions coming from our viewers, she's asking, what is the recommended viewing distance for reading on a smartphone?
As I said earlier, it should be at least arm's length or 18 to 24 inches away from your face.
Yeah, and a follow-up question to that is it recommended to watch movies on smartphone, tablets, or on the TV?
Actually, it's okay to watch them on smartphones and tablets as long as you maintain the distance, which is 80 to 24 inches. And then you adjust the brightness, adjust the size of your font, or whatever.
Okay. There's another question here. Are there any special procedures that can be done to alleviate the pains from MPS?
Special procedures?
Musculoskeletal pain syndrome. Besides
Usually rehab, yeah. We refer them to our rehab. Some will resort to chiropractors, depends. But definitely, it won't be relieved permanently if you're doing the wrong thing all the time.
Okay.
Diba? So dapat, gawin mo rin yung tamang posture and all. Dapat gawin. Kasi sometimes, damaged na rin yung spine mo. So, wala na talaga masyadong nagagawa. So, usually we resort to rehab. And sometimes, depende sa ortho, they have to operate.
Okay, there's several more. This is a very hot topic and a lot of people are asking questions today. So there's another question. What's the recommended period for kids when using digital devices? Is there a particular recommended time during the day for kids to use gadgets, and how long should kids use gadgets?
Kids, no?
Yeah, this is more of a developmental pediatric question. But
Yeah,
maybe you know. Do you know the answer to this?
no.
Actually, if I may, um, although it's pedya, no, I have kids kasi. So, and they're 3 years old, and according to their dev ped, it shouldn't be more than an hour or two in a day. So what we do actually, we try to, and they watch TV instead of a tablet. Kasi nga, because of an issue with the neck, no? With some neck strain and eye strain. So, especially mga toddlers to. So, we try to keep it 15 to 30 minutes at a time and interspersed within the day.
Okay.
So that's my answer on that. Last question, Doc Joy. Any recommended exercise for back pain? Lower back, I would assume.
Meron naman, wait lang. This one.
Okay, there you go.
These are exercises to combat lower back pain. But I cannot do that. Right? I cannot demonstrate. So I have this, and these are also other exercises. Yeah.
So
They can ask for copies maybe.
okay.
So, I think for low back pains, you have to increase your back, increase the strength of your back muscles. And by doing that, you have to strengthen your abdomens. Kaya abdominal exercises yun. Kasi pag strong ang abdomen mo, less ang back pains.
That's right. Okay, so I think that's the last question for the day. Thank you, Dr. Joy, for answering.
Thank you for your kind attention.